evening, everybody. I hope you can hear me okay. Using my little speakers here. I wanted to make a little video about gastroenterology and mast cell. This comes up frequently with clients and patients, and definitely in my own life and search and struggles as well. So finding a GI, if you haven't had to try yet, you might soon. And part of the challenge goes back to where a lot of other challenges occur in trying to communicate with physicians, getting accurate diagnoses, and feeling heard and seen, but also making sure that they are assisting in the process of describing your symptoms. One of the issues is back in the education phase. So what we come up with gastroenterology is that quite a few GIs have never had any training or only the bare minimum of introduction to mast cell activation syndromes. But they have training and have to be very concerned with things like mastocytosis or eosinophilic esophagitis, where there is an abnormal amount of eosinophils through the esophagus, a white blood cell. There's other conditions like this that they're highly adept and skilled in and have tests for, probably things that would benefit mast cell activation if we could adjust and create them to fit us. But what ends up happening is we might walk in with Ehlers-Danlos with a connective tissue disorder, and we're hoping to find a GI that understands things like chronic inflammation through the GI tract. You get an endoscopy. It comes back and says, oh, you've got some gastritis, drink less coffee, avoid alcohol. And we're going, we do. What else? Well, we'll try Mediterranean diet. Okay, but I react to all those foods. Well, I don't know about that. And you get kind of some stone walls if you've gotten that far. On the other end of it, you might have inflammation coming back on a colonoscopy of different kinds, or you're looking for answers to your chronic constipation and diarrhea. So let's say you get a good GI. A really quality GI. They're going to do those endoscopy, they're going to do the colonoscopy, they're going to stain for mast cells as a part of that process if you bring it up, and check for other major issues, irritable bowel diseases, Crohn's, the autoimmune condition of the GI tract. And if you're working with a decent motility specialist, they might run some motility tests. You eat some barium and some other things, and they just take pictures of it through your GI tract all the way out the other end, and maybe swallow studies. Yeah, and so they come back to you and they say, well, you look fine. What does that mean? What does that say? Does that mean they're a bad GI? No, it doesn't. It means that on their mast cell stains, they didn't see mastocytosis, which is what they're staining for, as an abnormal production. There's too many mast cells through the esophageal lining, the upper, your stomach, the duodenum, and the pieces, or the other end, you're coming up the colon into the small and large intestine, and all those little sphincters and pieces to that. What they mean by fine is that they don't see that you have an autoimmune condition. They see that you don't have cancer. They see that you don't have any major diseases. But in our minds, we're looking for more than that. We're looking for answers to the diarrhea, the reactions, the different types of inflammation. Those are all things that your mast cell specialist can answer. On the immunology side, we understand that while we don't have too many mast cells, they react inappropriately, which is why it's called an activation syndrome, or dysfunction if you're like me and we're just unstable, but it doesn't produce the same chemicals in the body. So we don't test positive on a lot of the tests and exams, or we can't get them at the right time to confirm the diagnosis. I was very fortunate to have a team that was willing to look at my history and my symptoms, and in spite of the testing, track and document very real responses to mast cell stability, and then provide a game-changing treatment for me in spite of lack of testing. That is pretty rare. It's difficult to get that far. But those mast cell nuances, GIs don't have training in those. If they've taken a special interest in them, then maybe they will, and maybe they can have more conversations. But they really can't do much, because what you actually need is mast cell stability. You need quercetin, cromolyn sodium, ketotifen, and people react to those. So there's other levels of different types of steroids. I'm allergic to steroids. Raise your hand over here if that's you. So they can't help me. And there's problems there, and some of us have the MTHFR mutations and other issues with the genetic makeup that make a lot of mast cell treatments even harder to get for all sorts of reasons. These are all things that are not in a traditional scope of a gastroenterologist. And that can work in our favor, really, because we can narrow some things down. We can go through our symptom history and list and mention things and bring it up, and they are going to rule out things that for you to pursue other diagnoses, you need to have ruled out. They need to rule out Crohn's. They need to rule out mastocytosis or rule it in. Those are not bad tests to have, and they're not doing a bad job or being a bad doctor because they don't understand the nutritional nuances of mast cell activation syndromes. Hopefully, within the next 10 years, now that people are realizing within the medical community that this is not rare, that it can be at least uncommon, if not completely common in our demographic, that's going to start changing. But changes in education take more time, but they're ultimately more effective and last much longer. They're still teaching things in some ways that it's how they taught it 50, 60 years ago. So once this gets in on the educational level, I think it'll stick and I think it will last. But until then, you can still get great progress with a traditional GI. They probably are not going to be the person who can be your point for a lot of EDS general things or helping you manage the nutritional side of your mast cell activation. There are some that do, but they're few and far between, and it's more of a personal interest. So call ahead. Ask the front desk your questions ahead of time. Approach your first appointment like an interview. Ask them, have you dealt with these patients? What's your approach to this? At the end of the day, a lot of times the good guys, and there's more good guys than bad guys, I promise, they will do what's necessary to make sure you're not dying and to make sure you are not having really extreme, cancer level things. Yeah. Now, coming back another time, I have not addressed gastroenterology and MALS, median arcuate ligament syndrome, which should probably fall under gastro, doesn't. I haven't addressed MALS. I haven't addressed gastroparesis in severe levels. That was intentional. I'm focusing just on mast cell activation syndrome and approaching a gastroenterologist in that purview. So we'll come back in another video clip and discuss some of these other much more challenging issues where we do need a GI and what we can do to make progress and work with the education issues in that category. That's all for now. Hope you are having a wonderful 2024.